Okay, so photobiomodulation is our topic. That's a big word, so I'm going to probably just call it PBM. It's what most people refer to it as just for short. Also, some of the research that I'm going to show, you'll see phototherapy, you'll see low-level laser therapy, low-level light therapy. They're all the same. So photobiomodulation is just the more current term that's been used. So for many, many years, in most of the research, it was referred to as low-level light therapy or low-level laser therapy. But they're all the same. So I just wanted to be clear on that so it's not confusing when we start seeing that in some literature. And PBM is just easier to say, so that's what I'll refer to it as. I think it's the greatest therapy to come along, at least in a very long time. I've been in practice almost 20 years, and it's by far the greatest thing to come along in my time in practice. I have a lot of chronic pain patients. You know, it's kind of a standard chiropractic clinic with chronic back pain, neck pain, migraines, carpal tunnel syndromes, and things that are very difficult to manage. I also do a lot of functional medicine and clinical nutrition, so I have a lot of thyroid patients and fibromyalgia, chronic fatigue, etc., a lot of irritable bowel, ulcerative colitis, and Crohn's disease. I spend most of my time doing that, and that's, since bringing photobiomodulation into the clinic, it's changed all of that as well. So I'll show you a few examples. This is by no means exhaustive. There are over 500 randomized controlled trials, which is the gold standard in medical research. So these are placebo-controlled, double-blinded, and so on. Over 500 of those to support the use of photobiomodulation or PBM. There are over 4,000 studies published in total on PBM in general. So there are plenty of human studies. They're not all animal studies. In other words, this is very firmly rooted in science. It's really indisputable at this point. I mean, we don't need another 500 randomized trials, to lend more evidence to that or to try to find a weakness. In fact, right now, I think there's just been more calls to do more research on different conditions, such as depression and anxiety, for example. I might have a slide or two in there pertaining to that, but I'll talk a little bit about those things anyways as we go. So I'm going to just kind of walk you through the basics of what it does, and then I'm going to clarify a few terms, just a few technical terms to be aware of, just so you can really grasp the gist of literature. And then I'm going to just buzz you through some of the peer-reviewed research. So I'll just point out ahead of time, these are all peer-reviewed articles that are captured from PubMed, which is the National Institutes of Health website. So these are all solid journal articles. This isn't something from Men's Health or Reader's Digest or something like that. So there's a lot of that stuff out there. And there's a lot of kind of really inaccurate information out there as well, especially online, a lot of false claims being made and so on. So I'll clarify those as we go. So as I mentioned before, it's formerly known as low-level laser. It activates repair processes in tissues independent of oxygen and glucose availability. I want to dwell on that for just a moment. That's a really remarkable thing when you think about that. So if you have a poor oxygen perfusion or poor blood perfusion to some tissues, we were speaking earlier about diabetic wounds, for example, like say ulcers on the foot of a diabetic person that won't heal. That's because there's an inadequate blood perfusion to that tissue. So if you don't have enough oxygen and nutrients, then you can't have repair. Photobiomodulation still works nearly 100% of the time in those cases, which is almost like magic. It's almost too good to be true. But when you look at other tissues in the body that are very slow to heal or they don't heal well, like cartilage or ligaments, if you have a severe injury to a ligament, or even a tendon tear, say a partial thickness tear of a rotator cuff, very, very difficult to get that to heal. A lot of times they won't, and they end up with surgery. In my experience doing this for the last couple of years, it's at least 90% successful in all of those things. And even we were talking about Kelly's case with a tibial plateau fracture, and that was what, 2 weeks? Something like that, 2.5 weeks. So those are the things that I had heard about for years, and I'd seen the literature for years. I was kind of gearing up to bring photobiomodulation into my practice. And it still does boggle my mind when you see it happen in real time. It's one thing to read about it, another thing to see it. But that is, I think, the most remarkable thing about PBM is the fact that you can facilitate healing. So you're not talking about just covering up pain or analgesia, in other words. You're talking about actual repair. And in tissues that otherwise probably would not have, or they take very, very long time to do. So a severe sprain, for example, say in a classic, a basketball player sprains his ankle and comes to my office, he could be back on the court in 2 to 3 weeks, where it would have been maybe 6 or 8 weeks prior to that, even with a severe sprain. So that's kind of I think the first thing to know about it and to understand is that we are talking about repair and not just pain relief. Reduces inflammation, facilitates soft tissue healing, it mitigates the effects of aging. That's a pretty bold claim too, but really it's worth pointing out before we start looking at all these different conditions that PBM is effective in treating. It really does one thing very, very well, which is reduces oxidative stress and inflammation. So on a cellular level, aging is just oxidative stress over time. And out of all of those, all of the published research, that's one thing that's very, very solid, is that's one thing that's known about PBM and has been known for about 40 years, is that it mitigates oxidative stress. And so you really are, I hate to use the term anti-aging because it's been used so often and so wrongly, but it really is. I think it's really the only thing out there right now that truly is, you could really accurately call it an anti-aging or sort of a pushback against the effects of aging. So really, people ask me very often in my office or just, when I'm out speaking like this, and they'll say, well, who should do it? Especially now, as we'll see, we have, full body photobiomodulation. And my answer is really everybody. I mean, like everyone who's aging. So everyone who's sort of over the age of 30, you start to accumulate the effects of aging. Certainly after the age of 40, that picks up quite a bit. A lot of that's tied to nitric oxide decline, and that's one of the things we'll see is this increases nitric oxide. So improved blood perfusion, improved neurotransmitter function within the brain, reduced inflammation, and so on. So that, it's really hard to exaggerate that and the power of that. So again, 500 randomized clinical trials, and the best part is no side effects, 0. So there's no contraindications at all. You can have hardware implanted in your body, neural stimulators, pacemakers. I have all of those. I have lots of those patients that have all of those things, and there's no contraindication. So 0 risk, which is nice. Never been a side effect reported. So this is just an example of a handheld photobiomodulation, a laser. So both lasers and LED diodes have been used up until just last year. That was the only mode of treatment, was to target a region and use a handheld laser or a cluster of LEDs. Now we have a full body pod. So that's just, one picture of the kind of the first one out to market. And so you could see it's like a tanning bed sort of a frame. There's no ultraviolet at all. There's no ionizing radiation at all. And so that runs, multiple frequencies in the 640 nanometer range, 810 nanometer. All that means is at those wavelengths, that's depths of penetration. So there have some of those photons will only penetrate about 1 centimeter, and then others can go 10 to 20 centimeters. So when you have it above and below, you're just saturating the entire body basically with that. So it's a way to treat head to toe. That's a newer model, and that's what we have here, where they added some green spectrum in there, as well as the near infrared and the red light. And the green spectrum has another advantage in terms of dermatology. So as far as skin rejuvenation, possibly better for wound healing. Still kind of seeing, but it certainly works for that. It even prevents, balding, male pattern baldness, that sort of thing. So there's all kinds of uses in acne and scars and wrinkle reduction. It'll do all of that as well. And that pod still has the deep and the shallow infrared and all of that sort of thing. So bottom line is, you want to basically saturate the entire body, so since there are no side effects, right? There's no risk. And this is really kind of an amazing thing, I think. The chromophores are these little components of molecules that absorb light. And we have chromophores in our mitochondria. So here's just a few of the technical terms I mentioned, but the mitochondria are the energy-producing units of our cells, right? And so ATP is energy. That's adenosine triphosphate, and that is cellular energy production. And so we have these chromophores on the mitochondria, and if photons of light hit those, it activates those mitochondria into action, and kind of it can be stimulatory. You can also have an inhibitive effects depending on the dose that you use. So when you look at the laser going through the skin there, and that's sort of a blown up diagram of a cell. So you have the photons hitting the mitochondria, and then one of the things that happens is you have this cytochrome C oxidase released, and that increases ATP production in the mitochondria. It reduces ROS, reactive oxygen species, so that's that oxidative stress or aging effects that we were talking about. And then also nitric oxide is released, and that increases the blood perfusion by dilating arteries, and the tiny little arteries called capillaries. So enhanced perfusion, reduced inflammation and oxidation, and increased energy production on a cellular level. That's why you have repair, like tissues can repair, because they can multiply and you can have healing as a consequence. Energy production, when you think of just mitochondrial disorders, it's chronic fatigue and fibromyalgia types of conditions, those systemic and very chronic and very debilitating kinds of conditions. It's a problem with ATP production. So I've done all kinds of clinical nutrition over the last 20 years, and it's always difficult treating people with those kinds of conditions, like fibromyalgia, for example. It's not just one thing. It's sort of an umbrella term, and you have a lot of different sort of sub-conditions in there. But this has completely revolutionized that. I've had patients of mine for almost 20 years that have been pushing back against these chronic conditions, and now I hardly ever see them because they've been able to have access to this, and they're better. And so I've got many of those patients who now tell people, yeah, I used to have fibromyalgia, I used to have chronic fatigue. A lot of people still accept these things are just permanent. They just think that once you have it, you're going to manage it for life. And it's really not true anymore. And I think without this, I think that still would be true. Because the best nutrition and done very well, and you can base that on lab tests, and you can dial it right in, and you can really make some positive changes. But it's never really, I've never seen it go away completely until I started, having access and started using it. Or dysfunction can be caused by environmental toxins. Well, we're all exposed to that. Stress. Most people in America consider lives to be overtly stressful, and that blocks production of ATP. So that's most people that come into an office like mine, they consider their lives to be very stressful. Oftentimes they're stressed out by the pain that they're now in. They kind of get locked into a vicious cycle, and we're all exposed to environmental toxins. There's no way around that. You can't escape it. You can go to either pole on the planet and you're still going to be exposed to these things. So the only thing we can do is really fortify against it. And that's really goes back to my answer that I give. Some people think I'm being sort of glib, or it's a tongue-in-cheek thing when they say, well, who should do this? Everybody. It's like that is really what I mean by that. If you have access to it, to not use it is a mistake. Especially if you're over the age of 30. And even more so, the older we get, the more we need it, right? So especially over 40 and so on. So everybody benefits from this. One of the greatest things about photobiomodulation too is it always works. And I've never been able to say that about anything before. I don't think I've ever seen another therapy where you can say that. If you take a living person and you put them in that pod, for example, or you treat a regional part of the body with a handheld, you can't not have that positive effect. And that's a really remarkable thing. So when people come in, I always tell them, if they have a condition that's conducive to this, any kind of pain or any kind of tissue that's under stress, it's inflamed, it's injured, and then I can always tell people, well, look, let's do this. How long is it going to take? Well, I don't know. It's going to take as little as a few weeks, as many as a few months, and it's going to be somewhere in between. It just depends on your overall state of health, and there's some genetic issues in there. But the fact is that it's always going to exert that effect. You can't not have that effect. You put any living person in that pod, they're going to have benefit, especially if they're over the age of 30. So you really can't fail. Of course, we're after a symptomatic achievement, and I'll tell people, I have about a 90% success rate with most of the conditions that I treat with PBM. We were just speaking earlier about neuropathy, which is a really difficult condition to live with. It's debilitating for a lot of people. I've had 2 patients over my career that have committed suicide as a consequence of chronic pain like that. And so far I have 100% success with neuropathy in my office using photobiomodulation. I know I won't have a perfect record over time, but everybody I've talked to that's been treating, like some people that treat nothing but neuropathy, and they all tell me the same thing. They're right around 90%. This is about 9 out of 10 times they're successful. And even when they fail, it's not utter failure. The person gets some better, but not great. So I would consider 50% improvement a failure. I would consider 70% improvement like still pretty good, but still I wouldn't call it. I wouldn't put that in the category of total success. Right now, I have total success, 100% symptomatic relief, restoration of function, people can move their toes again and that sort of thing. And sometimes it's extraordinarily fast. So I just had a patient, one of my last people I saw today before coming up here, and it was his 3rd visit, and he's already like 90% better after just 2 visits. I mean, it's kind of, I can't even explain that, like how it could possibly happen that fast. But his sensitivity to pinwheel, I mean, it's not something that they can exaggerate or fake, so the 2-point discrimination tests and that sort of thing, it's already better. I told him to prepare for 12 weeks. I figured like he wasn't an easy case. I told him it's probably going to take every bit of that. Well, It's probably not, so he'll probably be completely finished in just a few more weeks. So it all goes back to that mitochondrial thing. Just an example of articles out there. This is a 2014 article, Shedding Light on a New Treatment for Diabetic Wound Healing. I use this again because I think that's a great illustration of the power of photobiomodulation. If it can do that, if it can heal a wound that will not heal despite hyperbaric oxygen therapy and that sort of thing, then it's pretty remarkable. Just imagine what it's doing inside. Whether you've got internal injuries or you've got inflamed or arthritic joints and that sort of thing. It's that same kind of repair. What you can see visibly with the eye of these gaping wounds that close up pretty fast. Just imagine that that's what's happening internally as well, whether it's a fractured bone or it's damaged ligaments or whatever the case may be. This is just a caption from that article that was just up there. This is a quote from it. Impaired wound healing is a common complication associated with diabetes with complex underlying mechanisms and often necessitates amputation. With the advancement in laser technology, irradiation of these wounds with low-intensity laser irradiation, or PBM, has shown a vast improvement in wound healing. At the correct parameters, PBM has been shown to increase migration, viability, and proliferation of diabetic cells. There's a stimulatory effect on the mitochondria with a resulting increase in ATP, which is the energy production. In addition, PBM also has anti-inflammatory and protective effects on these cells. In light of the ever-present threat of diabetic foot ulcers, infections, and amputation, new improved therapies for the fortification of wound healing research deserves better prioritization. Exactly. So that one statement about has anti-inflammatory and protective effects on those cells, that's why too, if someone comes into my office and they have a wound that heals, I'm going to encourage them to adopt some kind of maintenance, some kind of prevention, because it's a fortification or a protective effect so it doesn't happen again. Makes sense, right? And so a lot of people are just doing once a month, and some of these people I've known for many, many years. Some of them have had terrible failed low back surgery syndromes and things of that nature. They have rods in their back and so on, really terrible chronic pain. And they're maintaining pain-free at once a month, which is pretty remarkable, to me anyways. And my eldest patient is just turning 95. I think he's 94 right now. He's incredibly arthritic. He's very fragile. And so over the years, he's been a patient of mine since the year 2000, so 17 years. And over the years, I've been able to do less and less for him or with him just because he is more fragile. So I just do PBM on him. I spot treat with handheld, and we put him in the pod, and he does fantastically well. And even his balance is better. I'll show you some stuff at the end here about how it affects the central nervous system, but there is, and I even just shine it through his cerebellum, and his balance is enhanced as he walks out the door. It's kind of a remarkable thing, but it's that fast. So when you look at, this is a partial list. It's not like an exhaustive list of the conditions that you can treat. This is probably, I guess you'd say, the most common presentations that I've seen, since I started doing this. And arthritis, of course, is number one, especially knees. I mean, the knee seems to be the easiest joint to treat, like you had that experience. But even with severe arthritis of the knee, I've seen at least a 90% success rate there. I've had a couple people cancel knee replacement surgeries after going through a longer series of that, which is, again, I think is pretty remarkable. So tendonitis, bursitis, plantar fasciitis. Plantar fasciitis is another one. So far I have 100% success. I haven't had a failure yet. Rheumatoid conditions such as lupus, scleroderma, Sjogren's, etc. Muscles, ligaments, tendon injuries like sprains and strains, depression and anxiety, migraine headaches, peripheral neuropathy I mentioned, and fibromyalgia. The depression and anxiety thing, I'll just maybe pause for a second on that one and just share this with you because I don't think I put this one in the slideshow. It's just a pilot trial. It's very small, 10 people from Mount Sinai Hospital, and they did an interesting trial with these 10 people that were really severe. They're kind of off the chart, so to speak, with the Hamilton Index for depression and anxiety. So there's standardized tests, and they were really high on, most of them were high on both depression and anxiety. Several had PTSD, some had substance abuse issues at the outset. But they did one single treatment through the forehead for 4 minutes and sent them on their way. And at 2 weeks, 7 out of 10 of them were in full remission from their anxiety and depression. And then at follow-up, they did 4-week follow-up, and the same 7 were still good. So that was it. That was the end of the thing, and they were just calling, we really need to get some funding, and we need to do more research in this. But I started doing it in my office on the basis of that one thing when I saw that one pilot study, because what does it hurt, right? There's no harm. And I've had the same experience. I haven't had 100% in that, but I'd say 70 to 80, probably 75% of the people I've done it on so far, which is only a few dozen, but it's been remarkable for a lot of those folks. And so I don't know exactly, how often to do it. I don't have any kind of protocol because nothing's really published yet. So I always err on the side of caution. And when you're doing PBM, even though you can't hurt anybody with it, it's very odd because as your dose increases, you get better results, and then if you do too much more, your results just drop away. And so, you always want to err on the side of less, less intensity and that sort of thing. So I've been having a lot of these people coming in twice a month, like every 2 weeks, just doing the treatment through the forehead. And I've got a few people now that have been over a year and they haven't had any of the depression, anxiety, that sort of thing. Some of them are off medications and all of the rest. So it's pretty exciting. So the last kind of technical term, I think, for the rest of this, and we can kind of roll along, is cytokines. And it's important to know just because a lot of the studies I'm going to just show you, I'm going to go through, just show you the gist of some of these abstracts and so on. They talk a lot about these cytokines. So cytokines are signaling molecules. You can really kind of think of them as hormones. They communicate the need for different physiological functions throughout the body. So kind of the big three that you see a lot that are kind of the big nasty ones are TNF alpha, which is tumor necrosis factor alpha. You'll see IL-1, which is interleukin 1 and interleukin 6. These are kind of like the ones that get the most attention. They're powerfully pro-inflammatory. So if you have an injury, let's say, or even more commonly, if your immune system, is attacking a bacterium or a virus that's somehow invaded you, then your immune cells will use these cytokines to signal the need for an inflammatory response. Or if you have an injury and you have injured tissues, you need to have inflammation to repair that. So these cytokines will be produced by the cells in that area, so you'll have an inflammatory response. So we have anti-inflammatory cytokines as well, right? And it's the balance between these two things that makes us, function properly. As sort of a very quick aside, but it's kind of germane to the topic. The average person in America has about 1/7 the level of long-chain omega-3 fatty acids that's required to even have any kind of remote possibility for health. That's like fish oil, EPA, DHA. The average, you should have about a 1-to-1 ratio because the EPA and DHA are precursors to anti-inflammatory hormones and cytokines. And omega-6s, which we get from grains and, pretty much the things that, eating the flesh of animals that were grain-fed, which is what most people do. So you should have a 1-to-1 balance from omega-3 to 6. You can have 1-to-4. You can skew it in either direction at 1-to-4 and still maintain optimum function. And this is according to the American Journal of Clinical Nutrition, which is the top journal in that field. And the average person back in 2000 was 1-to-20. And now some more recent articles are saying 1-to-30. You start getting 1-to-40 and you're looking at, chronic pain, depression, things like that. So if the average person, if 1-to-4 is as much as you can get away with, and it's not unusual to see 1-to-40, that's 10 times the upper limit. The average person is about 1-to-30. So that means that the average person cannot be healthy. Just on the basis of that alone. Like if you just removed vitamin C intake across America, you're guaranteed to see scurvy, right? Like if you don't have enough vitamin C, you're going to get scurvy. If you don't have enough omega-3 fatty acids, especially the long-chain EPA, DHA, then you're going to get one of a long list of diseases. Most of those things that I just had on that list, all the itises, you're going to have pro-inflammatory states. So it's worth noting because that's one of the reasons I think that I get better results than a lot of people that do PBM, is that I check for that stuff, or at least, just by simply making sure, like, do you ask people, like, especially if they're inflamed or injured, do you take, any EPA or DHA? And if not, get them on at least just 1 gram a day. It's inexpensive, it's simple. It's even at that minimum effective dose or minimal dose, that's safe to do even with people on, anticoagulant medications, that sort of thing. So there's no reason not to do it. It's super important. But it makes all of this work better. Because if I was, say, I beam the photobiomodulation laser through someone's forehead and it has this impact on mitochondria within the neurons of the brain, you'll see some articles on traumatic brain injury where it improves neuron connectivity, like synaptic connectivity. But if they don't have any DHA, if they're like the average person, then you're going to have you don't have much of a substrate to work with, so you're going to have less benefit, basically. You're going to have reduced results. So the cytokines, I just want to clarify those terms because you're going to see a bunch of these things in the articles that'll say like it lowers these cytokines. So that means it's lowering inflammation. One of the most important tests to have, just as another quick aside, is the C-Reactive Protein. That's a protein produced by the liver in response to these pro-inflammatory cytokines. So if your C-reactive protein goes up, you're kind of inflamed on a systemic level. And there's some interesting research behind that. There's plenty of it. I think it's still the #1 risk for heart attack and stroke, or #1 indicator for risk. And then there's homocysteine, and then way down the line there's cholesterol. And a lot of people are still hyper-focused on cholesterol, but they don't really think of these other things. If you never had a C-reactive protein test, just ask your doctor to add that the next time you have a blood draw and check your levels. It's a really interesting study from 2015 looking at semi-supercentenarians, like 104 to 109 years old, and centenarians from 100 to 104. So looking at over 1,500 of them around there, all in Japan, they found that the one common denominator amongst all of those people was their ability to attenuate inflammation. So like the title of the study was like inflammation, not telomere length, is this top predictor of longevity. It's a pretty important thing. So it's kind of a good thing to know about. Well, one of the coolest things, like, again, about photobiomodulation is it lowers C-reactive protein. So you get in that pod and you have a systemic anti-inflammatory effect. So it's pretty hard to say that anyone that's sort of over the age of 30 or 40 shouldn't do this at least occasionally, right? Because that is the #1 predictor of longevity. So you're really enhancing, you're stacking the deck in your favor for lifespan and health span. There's without any downside, like there's no possible. Interleukin-1, TNF-alpha, and there's interleukin-6, but they drive the degenerative changes in the cartilage of the joints. So this study's talking about pathophysiology, or the cause of osteoarthritis. So these cytokines will drive the degenerative breakdown of the cartilage in the joints, and it prevents the cartilage cells from being able to halt the progression. So the bottom line is you don't want to have chronically elevated pro-inflammatory cytokines systemically or locally, right? Like if it's a local thing, say in a knee, then you're going to just have accelerated arthritic changes in that knee. If you get in there with photobiomodulation, you can halt that process, right? And so we'll see another study or two on that as well. So I'll go through these, just kind of breeze through these a little bit quickly. I don't want to be dizzying about it, but it'll turn into ad nauseum. You'll get the gist of it. But just to show you that, again, I don't want anyone taking my word for anything, so I can show tons of research and references behind everything that I've said and everything I'm going to say. And so we'll just look at a small sample. I thought this was really amazing, actually, the PBM and exercise. So this study I'll show you in the next slide, it shows a decrease in inflammatory markers, so those cytokines went down. This is specifically in the elderly. And they looked at just PBM, and they looked at just exercise, and then they combined PBM with exercise. And the results, I thought, were pretty striking. So that's 2015 paper. That's just a quote from it. These results suggest that laser therapy in conjunction with aerobic training may provide a therapeutic approach for reducing the inflammatory markers interleukin-6, TNF-alpha. However, laser without exercise did not improve physical performance. That means that to get in shape or to have better performance, you actually have to move. You actually have to do the exercise. But this graphical representation is pretty amazing. So this is your interleukin-6 levels going up, so the pro-inflammatory cytokine going up. They used a control group of just young people, right? Like really young people shouldn't have any major cytokine elevation. Then their control group was just a group of elderly people. And then the third column is exercise. Well, first of all, look at the drop just from aerobic exercise in the elderly in their systemic inflammatory markers. That's an incredible drop. And then next over to that is just photobiomodulation, which is pretty close to exercise. This is one thing that's really cool too, is I have patients that can't exercise. I mean, they're in that bad a shape, right? Like my 94-year-old that I mentioned. But they can get themselves into that pod and they get close to the same benefits from an anti-inflammatory standpoint as they do exercising. But the final one, the star on it, that's the combination of this is like 30 minutes of walking, 4 or 5 times a week. I mean, this is not, doing a CrossFit workout or anything. It was really simple. And when you look at the level that they came back down to, I mean, it's not that much higher than the control group, of young people. So that's really, really remarkable from a longevity standpoint as well as a quality of life standpoint. Lower cytokines is less pain and it's better brain function. The number of people that I see that come to, I mean, it's no exaggeration, it's at least 1,000 people over the years. I've had closer to 17,000 total different patients, but probably 1,000 of those have come in just purely for thyroiditis, Hashimoto's thyroiditis, hypothyroidism. And that's the one thing that is still overlooked. Like sometimes nobody's checked their C-reactive protein levels. You do a high sensitivity C-reactive protein. Those cytokines will, if given enough time, will completely mess up your thyroid function. Like your gland might still be fine, it's producing enough thyroid hormone, but the conversion that takes place from your T4 hormone to T3, the more active form, it's 15 times more active, 60% of that's in the liver, 20% of it's in the gut. And elevated cytokines mess up both of those things. So you'll have abnormal conversion of hormones. I've seen it at least 1,000 times over the years, and it's kind of easy to fix in most cases, right? So before I had PBM, and certainly the full body PBM, I was doing all clinical nutritional aspects, and I had good success. Now that I have PBM, I do the nutritional stuff, tell them what, teach them what to do, and then they do the pod, and the results are through the roof. I get faster, better. So it's faster, better, and cheaper for everybody, which is great, right? Like, what's not to love about that? Same thing, the TNF alpha concentrations, same control group, the age controls, exercise and laser, and then the combination. And again, if you look at the last one with the star on it and compare it to the first one, that's a youthful population for a control group, and it's almost the same. So that means just doing some basic exercise like walking, riding a bike, and then doing photobiomodulation, and really in older people can drop their levels of inflammation back that far. So what could it do for a person at 45 years old? A lot, and it's even better, right? That's a lot faster, or 55, you know. So that's sort of just good information to know. So for gout, they call those microcrystalline arthropathies. It's just like gout is the classic example. They're very prevalent amongst geriatric patients who are more vulnerable to the side effects of drugs. Laser therapy was more effective than diclofenac, so that's a non-steroidal anti-inflammatory, in treating gout, and had no side effects. So that's the other thing, right? Like some of these studies will show, like this one, that the laser and the non-steroidal were about the same, you know, for pain relief and so on. Yeah, but the laser has no side effects, and it actually can repair what's left, and the non-steroidal anti-inflammatory can't do that. And not only that, the laser was superior to everything. It was the last line says laser therapy was more effective than the NSAID in patients with chronic pyrophosphate arthropathy, so say gout. It's again devoid of side effects, so it outperforms the medications without any side effects. Most people, when they come in, they do both at the beginning, and then as soon as their pain's going away, they can drop some of their medication. So there's plenty more of those. TMJ is pretty straightforward. Also, that joint is really accessible. So I've had, again, I think 100% success. I can't think of a failed TMJ case that I've had yet, and I've had dozens of those. It's super common. There's a study to show these results suggest that low-level laser can increase remodeling and enhance tissue repair in TMJ. Low back pain, there's been lots of studies on laser or PBM and low back pain. This one I grabbed as an example because I think it's the strongest. It's a 2015 article from a major journal. But this was a systematic review and meta-analysis. So they looked at 222 studies looking back over the published literature. 7 were randomized, 1 triple-blind, 4 double-blind, and so on. That's a total of 394 patients involved. And their conclusion was that PBM is an effective method for relieving pain in non-specific low back pain patients. However, there's still a lack of evidence supporting its effect on function. Well, it doesn't. Again, like they have to start actively, rehabbing or exercising to improve function. But I'll tell you, from a chiropractor's standpoint, when someone comes in with non-specific chronic back pain, that means that they're on the table, you're poking around trying to find like where it hurts, and there's no specific spot you can point to. That's never fun. It's never good. You don't look forward to those cases, right? Because they're very difficult. They're very hit and miss, so the success rate might be 50-50 for a lot of people like that. Whereas if you can put your thumb right on it, or you can find the epicenter of the pain, it's now 95% of the time we can get those better. So that's really pretty impressive to look back at a retrospective analysis that has 7 randomized controlled trials and to find that it was that effective. Because I can tell you there's nothing else out there that is that effective, like for back pain, for example, and same thing for neck pain. Like rehabilitation, chiropractic care done properly, rehab done properly, lots of great physical therapy, but nothing can compete with this. And so I was saying, we were talking before we started recording, and I said, I really think that in the very near future, anyone who's doing any kind of rehab work, PTs and chiropractors and so on, they're going to have to incorporate PBM because they're not going to be able to compete otherwise. But those wheels turn slowly. So knee, I mentioned, is I think the most receptive. It seems to me the knee is the most consistent of all the joints in the body. This seems to be the easiest one to treat. seemingly at any age. This is a 2015 study again. Does low-level laser and conservative care of knee arthritis successfully postpone the need for joint replacement? So I chose that one for that reason. I thought that was pretty interesting. So this is a prospective randomized study of 100 people, and they're all elderly patients with bilateral knee arthritis, with each knee randomized to either treatment protocol A, which was conventional physical therapy, or protocol B, which is the physical therapy plus the laser. So this is sort of speaks to what I was just saying. After a follow-up of 6 years, patients clearly benefited from treatment with protocol B. That's the one with the laser added, as only one knee had needed replacement, while 9 patients with protocol A needed surgery. We concluded low-level laser should be incorporated in a standard conservative treatment protocol for symptomatic knee arthritis. I mean, how could you not conclude that, right? I mean, that's a pretty big difference when there's one replacement in one group and 9 in the other. It was literally 9 times more common. So there's also another thing that's interesting about this is PBM facilitates the destroyed cartilage cleanup in joints. And it stimulates cells called fibroblasts to synthesize the new collagen to repair the joints. And that is also something that I always have to almost kind of give people a little bit of a warning, I guess you could say. So a lot of people, when they're starting therapy, I'll let them know, look, you might feel a little bit worse when you start, in the first 3 or 4 visits, and then you're going to get way better. Don't worry about it. In other words, this isn't hurting you. It can't do any damage, but it's part of that initial thing. And there's a study, one right there, that explains that. In their conclusion, so they were looking at osteoarthritic joints again. Their conclusion was low-level laser accelerated the initial breakdown of cartilage destroyed by the collagenase enzyme that was part of that arthritic process. And then it stimulated fibroblast cells to synthesize the repairing collagen type 3, suggesting a beneficial effect of low-level laser on osteoarthritis. It is. I mean, that's hands down. And again, there is nothing else out there as of yet. I think the stem cell research will come along, and that'll become, pretty much standard as well. We have a lot of that going on now. But I've seen the best results of people that have had those injections and then come into my office and had PBM, especially on their knees. Hips as well, they're a little tick longer, probably because they're so much deeper in there. It's like you get more scatter of the photons when you're doing the laser therapy, but it still works fantastically well. I've had labrum tears that have recovered. I've seen lots of different problems with knees and hips and ankles, shoulders. I've had people, 5 or 6 that I can think of, that have canceled rotator cuff surgeries, after going through 8 weeks to 12 weeks of, 2 times a week, 3 times a week. That's typical protocol, and they recover fully. So you actually get that tissue to repair. So that was the next one, tendon tears and laser therapy. So this studies that I'm going to show you next shows anti-inflammatory effect over the injured tendons and a decreased pro-inflammatory cytokines again, decreased pain, which allows the person to move it more, which improves the rehabilitation process, and it stimulates tissue growth release. Growth factor release. So that's, again, just how it facilitates repair. This is a 2016 study, and just to illustrate that prior slide, low-level laser modulates pro-inflammatory cytokines after partial tenotomy, so partial tendon tear. So that's why I like to show this, because it sounds really too good, right? It sounds very far-fetched. When you start looking at all the different things that you can do with this, it kind of, that's why I never have, like the last time I was up here in Greenville, that was the first time I'd ever publicly spoken about PBM. After all the time I've been doing it, I just kept to myself and in my office, and I have so many patients because I've been at it for so long. So I had already this big pool of people to draw from, right, that had chronic conditions. So as I was bringing that in, and I would tell people, hey, let's do this, because I think that can actually, fix your chronic issue or improve it a lot. So I had such a huge pool to draw from. I didn't need to go out and advertise it or anything or let people know it was there. Word got around pretty fast anyways. And so a lot of people started calling the office because of just purely word of mouth. But I'd never gone out and publicly in front of an audience and really spoken about it, partially because I was still paying attention to what works best, and I wanted to kind of have a better idea of how to predict what protocol will be best for each person, get better results. So there was a learning curve for me for a long time. The first few hundred people at least, maybe first 500-600 people. And also, it was kind of hard to think of a way to put this together that doesn't sound crazy. That's so to go out and start talking about it, you sound kind of like a fanatic. That's why I'm showing you this, because I don't want people taking my word for it. It's not my opinion, and so you're just seeing a smattering of the evidence. And I grabbed most of these studies that are, as you see there, is 2016. Most of them are 2015, 2016, maybe even 2017. So this is pretty recent. Nobody's pushed back on these things. There's nobody in that arena arguing about the efficacy anymore. I mean, it's just, it is what it is. So yeah, in conclusion, it should be part of the therapy. Same thing for skin. You know, increases tissue repair and healing, reduced effects on wrinkles, acne scars, hypertrophic, like the thicker scars from old injuries, improved healing with burns, that includes sunburn. And PBM can reduce ultraviolet damage to the skin as well as being a prophylactic measure. And I experienced that firsthand before going to Arizona. I did like 3 times a week in my pod for about 2 or 3 weeks before going. And I just want to see, you know, what would happen. And I had tons of sun exposure without any sunscreen and didn't burn at all. So, I mean, it was kind of cool. So sort of using myself as a guinea pig. But that's just one study. That's a 2013 article showing that just the same thing I just showed you. The photons are absorbed by mitochondrial chromophores in the skin. You know, that's not theory either, you know, that where we just started out with that. Stem cells can be activated, allowing increased tissue repair and healing. In dermatology, low-level lasers, beneficial effects on wrinkles, acne scars, hypertrophic scars, healing of burns, so on and so forth. Inflammatory diseases such as psoriasis and acne can be managed. That's very hit and miss in my office so far, but I have seen some pretty remarkable changes with psoriasis in some folks, and then I've had others where it didn't really change it at all. So, but it, again, never hurts to try, right? There's no downside to it. So the non-invasive nature and almost complete absence of side effects encourage further testing in dermatology. It's not almost complete absence, it's a complete absence. The only way you could hurt a person doing photobiomodulation is to shine the laser in their eyes. I mean, that's the only way. So it's pretty easy to avoid doing that. And then in the pod, you know, you just have your little goggles similar to a tanning bed. And even in there, like, you'd have to stare into the light and to really, you know, hurt yourself doing that. So that's it. As long as your eyes are protected, there's zero potential downside. The wounds heal more rapidly, inflammation is reduced quickly, tissues repair themselves, and even those tissues that have almost zero oxygen or nutrient supply, i.e. cartilage, tendons, spinal discs, you know, again, diabetic wounds and so on. CNS, the central nervous system, just a couple quick things there that are very interesting. So the same thing in the brain, it increases the cellular ATP production, decreased nociceptive neurotransmitters, that's just pain. So those are pain receptors throughout the body. It increases the natural analgesics in the body, like enkephalins and endorphins, and a reduction in global pain in the body. And this was interesting. Like, there was a study where they did transcranial low-level laser, and as you can see, it temporarily inhibits peripheral nociception. That means pain. So it says, it's been shown to attenuate both acute and chronic pain, but the mechanism is not well understood. In most cases, the light is applied to the painful area, but in the present study, we applied it to the head. This was the first study to show the inhibition of peripheral pain due to photobiomodulation of the central nervous system. So that's pretty cool too, and that's one of the benefits of being in the pod, because your head's in there, right? You also have your long bones, like your shin bones, will absorb a lot of those photons, and you'll have mesenchymal stem cell production increase. So your stem cells going up, especially as we're getting older, they go and repair whatever needs repairing anywhere in the body. So that's part of the rationale behind the whole body thing. So the advantage to the handheld is you can get deeper penetration faster, so you can spot treat and target, like, you know, kind of the main areas of concern. But then you can get in the pod and you have all these systemic effects, including the fact that you get some transcranial effect, and you can attenuate pain in the whole body. So people that have chronic pain in their feet, you know, I'm still going to do transcranial to attenuate the pain, because it attenuates it everywhere. So think of a fibromyalgia person, or someone who's been suffering with chronic pain from whatever, old injuries, back, neuropathy, or, you know, failed low back surgery, etc. It's really remarkable. So some of the people that have rods in their back, like they have Harrington rods in their spine, so I can't do any manipulation. They're pretty limited on what anyone can do for rehabilitation. So they still benefit, and they get in the pod and benefit, but I think a lot of that's coming from the transcranial effect. And so I've used the handheld to even use a little bit more of a higher intensity beam through the forehead, and they get pain relief everywhere, you know, even in areas that I couldn't otherwise treat. So even phantom limb pain, I've had one patient that's had improvement in that. So low-level laser for musculoskeletal pain, basically just saying it's the most common reason for a physician consultation in the US. 1 out of 3 Americans is affected by chronic pain annually. That's kind of amazing. 1 out of 3. The #1 reason for missed work or school days is musculoskeletal pain. So that's muscle, ligament, tendon, joints, etc. Currently accepted therapies consist of non-steroidal anti-inflammatory drugs. Well, those have problems over long term, right? Like you always see the commercials, like only one, what is it, all day strong, all day Aleve or whatever. Well, that's great if it's very periodical, but if you do that every day, it doesn't take very long until you're really pushing the envelope for side effects. I still think it's kind of amazing. Like at least 10 years ago, I saw a study. It was like 116,000 women, Harvard Nurses Health study. So it's huge in scale and in scope. And they're looking at like 1 aspirin a day increased breast cancer risk by 80% after 5 years. And it still seems that nobody knows that. Even 1 ibuprofen a day increased breast cancer risk by 50% after 5 years. That's pretty scary stuff. And there's other studies too, Nurses Health studies on pancreatic cancer with non-steroidals over time. So when we see stuff like that, and we have these things available now that offer solutions to people that have no negative side effects, it's that much more remarkable, because not only is there something that's better and works better, but you can also avoid these pitfalls that come with chronic medication like that. I'm not anti-medication, I'm not anti-non-steroidals, but they shouldn't be used like that. Like that's not an ideal scenario. Take even 1 a day, the all day long, all day strong thing. Yeah, well, it's also going to give you a heart attack or a stroke very likely, or give you cancer. We don't know about cancer for men, but I would predict that prostate cancer would probably mimic breast cancer risk going up with these non-steroidals over time. So that's kind of the gist of that. What are needed are more effective treatments for pain, which have an acceptably low risk profile. For over 40 years, low-level laser therapy has been shown to reduce inflammation and edema. That's kind of remarkable, right? 40 years it's been known to do this stuff. It's really only been done clinically, like it's been picking up the pace for treating people with it over the last 18 to 20 years. So yeah, photobiomodulation is shown to reduce inflammation and edema, so swelling, induce analgesia, which is pain relief, and promote healing in a range of musculoskeletal pathologies. The acceptance of low-level laser, which is currently being used by many specialties around the world, into the armamentarium of the American healthcare provider would allow for additional treatment options for patients. A new cost-effective therapy for pain could elevate quality of life while reducing financial strains. Isn't that what it's all about anyways with that? So it's really, really hard to exaggerate the impact of that. So there's the mood disorder I was talking about. PBM improves neurogenesis, that's the birth of new brain cells, metabolism within neurons, and then reduces oxidative stress and inflammation in the brain. So it's a promising thing. I can't show you studies like these other ones, like these retrospective analyses and so on. There's just pilot trials as far as I've ever seen so far. So it would be interesting when we have something large, like 300, 400, 500 people, and it's randomized, placebo-controlled. One of the awesome things about PBM is it's easy to do a placebo control, right? They just put red light on you, right? You don't know if it's the real thing or not. It just looks the same. So it's a perfect, sham treatment. So it really lends itself to double-blinded studies like that. And I mentioned I haven't seen 100% success with this, but at least 70, 75% in my own office. And I've only had maybe a few dozen people, so it's not a huge number yet. But it's enough for me to start feeling more confident telling other people, like if you have a 70% chance of success by doing something so simple as, beaming a laser through your forehead, why not give it a shot, right? And so that's kind of what I'm telling people now. That's just another paper of 2016 again, the transcranial PBM for major depressive disorder, targeting brain metabolism, inflammation, oxidative stress, and so on. So there's clinical evidence suggesting the efficacy of photobiomodulation in treating major depressive disorders, anxiety disorders, suicidal ideation, and traumatic brain injury. And that's a quote from it. Based on the data collected to date, PBM appears to be a promising treatment for depression that is safe and well tolerated. So very, very exciting. A lot of people, and you don't have to, a person wouldn't have to stop their medication to try this. They don't have to change anything they're doing. They can do the same therapy if it's cognitive behavioral therapy or EMDR or something like that. That's great. They can do the same medications, psychotropic meds, and they can just add the PBM in. That's what I've been having my people do. I don't tell them, do this instead of your meds. But when they do it and then they recover, then they go to their doctor and they say, yeah, you don't need it anymore. Let's get rid of your... So it's pretty amazing because up until this point in my career, most of those people never get off those medications. Once they're on them for life. They just switch them out. One stops working, they give them a different one and so on. So there's neuropathy I mentioned before. This study just shows that this person these subjects improved in as little as 2 visits and had full resolution after 26 visits for neuropathic pain. So recovery began after 2 treatments, reached full healing by 26 treatments. I don't think I've seen anybody take 26 treatments to even fully recover. I think mostly they really get liftoff at about 8 or 10 visits. So a lot of them are doing 2 times a week, and after about 6 weeks, 8 weeks, they really start clearing up. So a lot of them are symptom-free by the end of 8 weeks. And again, no side effects, and there's nothing else for them. There aren't any medications that can correct neuropathy. There's nothing even really effective to deal with the pain except opiates, and we all know how that's working out, right? So I mean, as that gets less available and it's more difficult to achieve, and so I don't think the best answer isn't medical marijuana for those patients, although that's better than opiates. This is the best. This is by far the best answer. And so PBM and diabetic vascular disease. It's an alternative treatment option for conventional diabetic vascular conditions. It minimizes the adverse effects of high blood sugar on endothelial cells. Those are the cells on the inside of the artery wall. That's the 2016 study that just shows that. It's just kind of what I just mentioned there. Improved profile in obesity with PBM and exercise. I thought this was pretty interesting too. This study, I'll just show you the paper, 2015 article, the potential of phototherapy to reduce body fat, insulin resistance, and metabolic inflexibility related to obesity in women undergoing weight loss treatment. That inflexibility, they're talking about people that really exercise, say like an hour a day or more, and they eat pretty well and they just cannot lose weight. Like that is a real thing. And a lot of times they're endlessly frustrated because their doctors kind of think, yeah, I mean, they're sort of, not being honest about what they're eating and that sort of thing. But that is a real deal. That's the metabolic inflexibility they're talking about. So this study was showing that combining exercise with PBM was effective in controlling the lipid profile, that's cholesterol and triglycerides, reducing the mass of body fat, that's adipose tissue, suggesting increased metabolic activity and changes in lipid metabolism. Lipids are fats. So, quote, our results demonstrate for the first time that phototherapy enhances the physical exercise effects in obese women undergoing weight loss treatment, promoting significant changes in inflexibility and metabolic profile. So I've seen that same thing happen too. I've had several people that I've known for many, many years, patients of mine, that they've done every kind of diet and they've done HCG injections and so on, adding these therapies in and then adding and having just a walking, biking, just simple exercise routine has completely broken their plateau and changed their set point and so on. I've had people, I'm going to have some of them have done just little simple video testimonials for me that I haven't yet put on our clinic website. But they're remarkable stories. Like one of my patients, Janet, she's going to be on there. She's been obese since she was 8 years old. She's now in her mid-60s, and she's at her she's within the optimum body weight range for the first time since 8 years old. And there's another one, Nellie, who's going to be on there. She's 70 years old, and she's been struggling with weight loss for 25 years, and her doctor's worried she's losing too much weight, and she's now trying not to lose any more weight, and it won't stop. She's not losing muscle though. She's just burning fat, but she's lost 60, 65 pounds. She's about that high. So, she's totally rail thin, and that's the difference. That's the catalyst, right? And a lot of that is the cytokine stuff. If you take a person who's like very fit and they've never had a problem with weight, and if you inject them every day with those pro-inflammatory cytokines, they're going to start gaining weight. They'll also become depressed, and they'll become anxious, and they might have panic attacks and so on. This has been studied. And so there's a great article called Cytokines Sing the Blues, and that's what they did, is they injected people that had never experienced depression with those pro-inflammatory cytokines on a regular basis, and they became profoundly clinically depressed. So Cytokines Sing the Blues was kind of the tongue-in-cheek title, but that's what it was alluding to. And that's, I think, where it's not just the transcranial effect there for the depression that I mentioned earlier too, because it does reduce the cytokines systemically, especially the pod. You get in that pod, you're having a systemic reduction in inflammation, and that's antidepressant in and of itself. So that's really pretty cool that that's been studied in a peer-reviewed journal, but I have seen that in my own office. I've had, I don't know, we probably have a dozen people that have agreed to do just little video testimonials that we can put out there for other people. So acute traumatic brain injury. So this is post-concussion. I can tell you this is good to know. I mean, if you ever have a concussion, or if you have a child or any kind of friend or relative, especially a kid though, if you have a kid with a concussion or you have one, the very first thing, you should go to the hospital if it was severe. But once you're sort of all clear, immediately get in here for this, because it's a really, really powerful way. And there is no such thing anymore as a mild concussion. That language isn't used in the most contemporary traumatic brain injury literature. I sat through 400 hours of lecture on traumatic brain injury a few years ago, like over the course of about 2 years or a year and a half. So I'm pretty up to date on all that literature. And that's one of the things that that kind of intrigued me about this too, is that, you know, I have lots of young patients, football players, for example, or girls playing soccer. It's the number one reason for concussion in young girls is soccer. But gymnastics and so on, and you know, if they ever kind of, you know, bump their head, they just come right in, and we just, you know, we get right to work on it, and it's preventative. So it's like it'll help to heal it, but it prevents it from getting worse, spiraling out of control. That's a different story, but the problem within the brain is once you activate these inflammatory processes, they can kind of like snowball, and they can continue to burn even when the cause of the inflammatory insult's taken away. So you can get these things called microglial cell activations. There's no off switch. So like you want to use this as your off switch to get that to dampen that effect. This is 2012 from the Journal of Neurotrauma. So MRI reveals decreased infarct lesion volume in PBM treated subjects. Long-term functional neurological benefit is a quote from that study. Is just to show what they found. So again, it's not theory. It's well documented. So Bdnf is brain-derived neurotrophic factor. And that's been nicknamed Miracle Grow for the brain, is literally how it's usually referred to. So it's brain derived, meaning your brain produces it. Like when we exercise, for example, you know, at around 20, 30 minutes in of exercise, you start producing more Bdnf, which is one of the reasons exercise is so important for the brain. And it's also, there's always been an inverse relationship to Alzheimer's and other dementias, as have been shown for many years. And that's a big part of the reason why. And so Bdnf acts on the neurons of the central nervous system and the peripheral nervous system. So it's basically repair and maintenance of your brain and peripheral nerves, like of nerve tissue. And of course, you know, survival over the long term. So it minimizes your risk of dementia. And there's a 2015 article, low-level laser for traumatic brain injury in mice increases brain-derived neurotrophic factor and synaptogenesis. These things extrapolate perfectly well to humans too. So just another thing, another benefit from photobiomodulation is the Bdnf secretion. There's one on learning, memory, and neuroprogenitor cells after traumatic brain injury, 2014 article. So same idea. It can improve TBI outcomes, so it's post-concussion, especially at 3 or 4 weeks of treatment. That's usually about all I do. Like post-concussion, the people I've had coming in, I'll have them come in. Usually for that, it's just twice a week for 4 weeks, you know, and they're good to go. They start seeing changes right away. It reduces cell death by stimulating neurogenesis. So that's like the birth of new neurons, which is quite remarkable as well. That's not something that we have a lot of. And within the hippocampus and dentate gyrus, so it's, you know, short-term to long-term memory, so retrieving memory and that sort of thing is hippocampal. And so, you know, that's, yeah, it gives you a little edge in school and things like that. So, but hippocampal, yeah, and that's a really important thing, because that's also thinking really long-term. That's correlated with other, you know, dementias and things in older age. So having a healthy hippocampal function is super important. And it's involved in different things like circadian rhythm and other things like that. So that just sort of restates what I just said, you know, that neurogenesis in the hippocampus, if you decrease that, it leads to Alzheimer's, schizophrenia, insomnia, stress, depression, this feeling of overwhelm people will have with things that never used to overwhelm them. You know, those are common things. A lot of people, when I see that on my intake, they don't get pleasure from things they used to enjoy. They're not interested in their hobbies anymore. Some people will say they have a hard time calming their mind when they want to relax, like they can't shut it off. And so all of those things, I have seen a very high success, like got to be about 90% using transcranial photobiomodulation, and it's really fast. Some of them I only treat them once or twice, and they're good to go. So we're at the end. Just a summary though, any tissue that's injured, inflamed, degenerating, or simply painful will benefit from PBM therapy. And that's kind of just reiterating what I said before, and I think it's worth repeating because it is a bold statement, you know. And as the saying goes, sort of like, you know, bold claims require, you know, bold evidence, and that's why, and that's not exhaustive. I mean, we could sit here for many, many hours and look through, you know, study after study. There's so many of them, just going even through the 500 randomized trials. So you see this huge cross section, and it's just nothing. It's nothing but positive. I haven't really found anything negative. I haven't found any research to say that there's a weakness here, it doesn't work. And after 500 randomized trials, I can't imagine we're ever going to see that. Right? Like how, and if it ever did come out, I would immediately look to the study design because I'd want to know how they did it. The only studies I could ever find where they didn't have great results, there were flaws with the way they were doing it. They were using too much power. They weren't using the proper frequencies or wavelengths or wattage. So those things all matter. You have to have the proper parameters to get the results. Otherwise, you just get no result. So there's never been any harm, but the only studies that I've ever found out there that are old where they didn't see great results, it was a problem with the way they were doing it. There was a problem with the clinical approach. So any tissue that's injured or inflamed or what have you will benefit from PBM. That's just the fact. It always works to improve tissue health, although treatment protocols and symptomatic outcomes vary. That's what I was mentioning in the beginning. I like the fact that I can say to people, look, we're going to do this series. You're guaranteed to benefit, right? You are going to be better off than you are right now. Your tissues are going to be better off. Of course, we want to get the symptomatic improvement, whatever they're after, whatever pain relief or whatever they're after. But, and that mostly all the time happens, but not 100% of the time. But it's not going to ever be a waste of their time or investment because they're always going to be getting some benefit, right? You can't not benefit. And so there are no contraindications or side effects, typical treatment protocols. For almost everything that I've treated, it's 2 or 3 times a week. You got to do at least twice a week, I've found. Like I've had some people because of their job or their travel a lot, like I've treated people with once a week. And I still have seen success, but it's a lot of times it's taking so long, right? So like they're either going to bail or I'll say like we'll figure out a way to get in a second visit, and just in a few weeks they just get lift off and everything's good. So usually 2 or 3 a week. It's better. You can do it back-to-back days, but it is better to split them up. So like I've found, because I've done that with many different people, and if the only way they could do it is say do like a Wednesday, Thursday every week or a Tuesday, Wednesday, Thursday. I've done that and had success. But it's a bit better and faster if you split it up, like if you do like a Monday, Wednesday, Friday or something of that nature. Or if it's twice a week, they can do Monday, Friday. It doesn't really matter. But if it's all the same to them or to the person, leaving a day between is a little bit better. The more chronic the condition, the more treatment is needed usually. And that makes sense. So someone's coming in with, they're really decrepit, they got severe arthritis or some rheumatoid condition they've had for 25 years. I'm not telling them to expect liftoff in 3 weeks. It does happen, but it's just a bonus when it does. But I'm going to be telling that person they're looking more like at a 12-week protocol right out of the gate, and then from there we'll start titrating down or tapering it off. So I've had some of the toughest conditions. I've had people go as many as 40, 50 times. I think one of the people who canceled her knee replacement, I think she did do something like 50 visits, over many months. But she had other problems too, and they all got better. And she also was never able to lose weight. She lost a bunch of weight. She was not inflamed anymore, so everything was good. But she did do a tremendous amount. So I've had some people do that and need that. But most people, somewhere between 1 month and 3 months, and they're good to go. The vast majority of people. Overall health status typically is a predictor of treatment length. So not always, but if someone smokes a pack of cigarettes a day, they drink 2 liters of Diet Mountain Dew every day. These people, I have lots of these people that come in. So if those are the kinds of lifestyle factors, they haven't exercised in decades, they're going to take a little longer. It probably goes without saying. But it's not absolute either. I've seen some of the most unhealthy people I've ever met, and they still got better in just a few weeks. Independent of their 2-pack a day habit and that sort of thing. So that's the thing that continues to blow my mind when I see that kind of thing. When someone who has like very poor health status, they're super inflamed, they smoke literally 50 cigarettes a day, they don't exercise at all, they eat terribly, and they still get better. And if I was just using my hands and some like clinical nutrition stuff, I wouldn't have even taken them because they would have failed. So I would have said, I'm sorry, I can't help you. It's too far gone. And now, when those people come in, I can help them because I have this kind of tool in my toolbox. And so it's like a secret weapon for all these different things. And so that takes us to the end. Are there any questions about any of that anyone can think of? Or was I that thorough? Anything?
How does it help athletic performance? You can touch on that a little bit more.
Athletic performance is mostly, from my experience, it does enhance some performance, and this is not, like I couldn't show you, solid research on this, but as far as like the neurological benefits that I was talking about, like the transcranial component by putting someone in a pod, I mentioned that I had that very, very elderly patient, and I use a handheld beam right through his cerebellum. And this is the back of the brain, it's involved with balance and so on. He can literally get up and walk out of my office after 4 minutes of PBM through the cerebellum every time. So I think of that, this fellow's in his 90s, but you imagine a young person in their teens or their 20s, they shouldn't need that, right? Like if there's not a problem already there. But a lot of these youngsters that I've seen have had some, concussions, whether they were minor or not. And so I have seen performance enhancing effects just because of that. I think from prior TBI or traumatic brain injuries. On top of that, I think where you get a lot of performance enhancement is just the fact that you recover really fast. So when someone's just starting a season out, how sore you'd be at the beginning of a season, or if you're starting a new workout program, and it attenuates that really, really quickly. So they can kind of push it harder, train harder, and then not have these after effects. So I think that's where a lot of the performance, especially in sports and things, that's where I've seen most of it. But just the attenuation of so you're less likely to be injured. And I think that's super important as well. I mean, it doesn't take a lot, especially for young people. Like they might just, jump, and if they have a problem, they might do a couple times a week for a few weeks, but they might just do once a month after that throughout the season. Or I've got lots of ultra endurance, not lots, but I have some ultra endurance patients, 100-mile marathoners and so on. And so they'll do that. They'll do PBM a little more frequent right before a 100-mile marathon or an Ironman event, and then right after, so recovery's better. But a lot of them will do it just monthly or every 6 weeks or something as part of their training. So it makes it less likely they're going to develop something like a Achilles tendonitis, or have a knee issue, or any kind of ligament or tendon problem, or bursitis. So you get a lot of performance enhancing out of that.
I have a question.
Yeah.
What about somebody who's in generally in good health? I'm talking about big ass, I don't know. But what does that look like as far as use of the tool? I mean, I'm achy in the morning, yeah, but then I'm good.
Yeah.
But
Yeah.
I don't have a chronic condition either,
Right.
that I would be like, I really need this treated.
Yeah. Then I would just adopt it like I do myself. I mean, I do it not because I have to. I don't have any symptoms of any kind. At this point, I had a major neck injury, I had a huge disc herniation. So I had some atrophy and stuff happened about maybe 9 months or so leading up to when I got the full body pod. So I had successfully avoided surgery for the second time using laser therapy and just simple, some manipulative therapies and so on. But I still had some residual effects in my left arm. And when I got the pod, I did Monday, Wednesday, Friday for about 4 or 5 weeks, and it completely took that away. So I don't have any kind of symptoms or complaints, but I still get in there. I get in there once a week because I have it sitting right there.
Yeah.
So, but even if I didn't, I would definitely do monthly. I would do,
once a month?
yeah, if not twice a month, just for and I go more often.
Forever?
And yeah, as we get older, the more we need it, right? But I think I could say this. I mean, at very minimum, just a healthy person wanting to maintain health, and like I said a few times, every time you get in there, you're going to be benefited, right? Like it will mitigate a lot of the accumulative effects of aging from oxidative stress. So something like every 3 weeks or 4 weeks, I would adopt some kind of a wellness approach to it. I mean, I do that anyway. I do it more often than I need to, I think, just because I have one. But even if I didn't, if someone else in my area had one, I'd be going. I think I'd probably go every other week myself. But I would say that I think that anyone over 30, you're looking at once a month. It's all upside.